Welcome to the deep dive. Today we're tackling something that definitely causes a lot of anxiety for parents. Infant cough.
It really does. That little sound can be so worrying.
Exactly. When is it just, a sniffle? And when is it serious? We've looked at pediatric guidelines, health briefings, trying to get clarity for you.
Yeah, our goal today is really to cut through some of that confusion, give you the essentials on when a cough is a real danger sign.
And crucially, when imaging like x-rays or CT scans might actually be needed and when they're not.
That's a key point, definitely.
Okay, so let's unpack this. Parents hear a cough, they panic. What's like the baseline? What's usually normal?
Well, most of the time, honestly, an infant cough is just part of a common cold. Should probably clear up in, say, 7 to 10 days.
Okay.
But, and this is the important bit, babies are different. Tiny airways, not much reserve. So small issues can escalate fast.
Right. So what are those escalation points? The red flag.
We need to think in terms of like 3 main danger clusters. That's the easiest way to remember.
Okay, 3 clusters. What's the first?
First is breathing trouble. This is number 1. Look for really fast breathing.
How fast is fast?
For an infant, that's usually above 60 breaths per minute.
Yeah.
Also, look for chest retractions. That's when the skin sinks in around the ribs or neck when they breathe.
Okay, I can picture that.
Nasal flaring too. Grunting sounds with breathing, wheezing, or stridor. That's a really harsh, high-pitched noise when they breathe in.
Soidor, okay.
And the absolute emergency sign, bluish lips or fingertips, that means low oxygen. All emergency services immediately. No hesitation.
Got it. Breathing trouble, cluster 1. What's next?
Cluster 2 is feeding and hydration. Super important. If your baby just refuses to feed, or maybe they feed but vomit everything back up, they can get dehydrated really quickly. Watch the diapers. Fewer than 6 wet ones in a 24-hour period. That's a warning sign.
6 wet diapers. Okay.
And also check the soft spot on their head, the fontanelle. If it looks sunken, that's another dehydration sign. Needs checking out fast.
Right, makes sense. And the third cluster?
Fever and behavior changes. Now, fever in babies is tricky. Any fever of 38 Celsius, that's 100.4 Fahrenheit, or higher in a baby under 3 months old, that needs medical attention, period.
Under 3 months, automatic call.
Yeah. And for slightly older babies, 3 to 6 months, a fever of 39 Celsius or 102.2 Fahrenheit is the threshold.
And behavior?
Watch for big changes, like extreme sleepiness, being really hard to wake up, or the opposite, just crying constantly, inconsolably, lethargy, just not being themselves.
So pulling that together for you listening, if that cough is messing with breathing, feeding, or just how your baby acts, you need to get medical advice right away. Don't wait.
Exactly. Trust your gut, but know these specific signs.
Now let's get to the imaging part. This is where I think a lot of us assume, shouldn't they just do an x-ray to be sure? When is that actually needed?
That's a really common thought, but the guidelines are surprisingly clear. Routine x-rays for just a normal viral cough.
Yeah.
Not recommend. Well, they add cost. They expose the baby to radiation, and usually they don't actually change how the doctor treats the cold.
Okay.
What's kind of interesting, even one single chest x-ray gives a baby about the same radiation dose as 3 days of just living on Earth, background radiation.
Wow. Okay, so it's not nothing.
It's not nothing, exactly.
Yeah.
So x-rays come into play only if there are specific worries, like if the doctor suspects pneumonia and the baby seems quite sick, or if there's really significant breathing difficulty, or maybe they're worried the baby inhaled something, like a tiny toy piece or food, foreign body aspiration.
Oh, right.
Or if a cough is wet and just drags on for over 4 weeks, an x-ray might be used to look for underlying issues, like bronchiectasis.
Okay, so specific situations, not routine. What about CT scans then? That sounds even more serious.
It is much more serious in terms of radiation. A chest CT gives like 30 to 100 times more radiation than a simple x-ray. Yeah, it's a lot. So pediatric groups are really strict about this. CT is reserved for very specific, usually complex situations.
Such as?
Things like complicated pneumonia, maybe something called necrotizing pneumonia where the lung tissue is actually damaged. Or if they suspect a birth defect in the lungs that the x-ray didn't explain.
I see.
Or sometimes for monitoring kids with known chronic lung diseases, like cystic fibrosis, but only if the CT results will actually change their treatment plan. It's absolutely not for a regular cough. It's really a last resort after other things, maybe even ultrasound or MRI, have been considered.
Okay, that's really clear. So let's sum this up. What are the crucial takeaways for you from this deep dive?
Okay, key things. Trust the pattern. Is the cough getting worse? Is it linked to breathing or feeding problems?
Yeah.
That's your signal for medical check.
Right.
Remember, any fever in a baby under 3 months is urgent. Always.
Got it.
Imaging isn't step one. Most coughs get better on their own, no pictures needed. X-rays have a role, but it's specific. Think pneumonia concerns, maybe aspiration, serious symptoms,
Okay.
and CT scans. Very rarely needed for an acute cough. They're for complex, chronic, or really puzzling lung problems where the answer will directly impact major decisions like surgery or long-term therapy.
So use the baby symptoms as the guide, not the technology first.
Precisely. The technology is powerful, but it needs to be used wisely, especially the high-radiation ones like CT.
So as we wrap up, what's maybe one big thought for people to take away from this?
I think it's that coughs in babies are common, yes, but they deserve respect. Let the symptoms guide you. Understand the tools, like imaging, but know they're meant for specific jobs, not just, just in case. Be informed, not just anxious.
That's great advice, and maybe something for you to think about. How can knowing these specific danger signs and knowing when imaging is or isn't the right step actually help you feel more confident, maybe a little less overwhelmed the next time you hear that cough?